The White House appears to be inching closer to a compromise on one of the most contentious aspects of President Barack Obama's proposed health care reform, the public option. Republicans and fiscally conservative Democrats contend that a government-run insurance program would be too costly, and many would be hard-pressed to support a bill that includes one. Facing that reality, the president, who has long supported the idea of a public option, seems to be hedging his bets.
All I'm saying is, though, that the public option, whether we have it or we don't have it, is not the entirety of health care reform. This is just one sliver of it, one aspect of it.
Other administration officials, including White House spokesman Robert Gibbs and Health and Human Services Secretary Kathleen Sebelius, have echoed the president's comments.
The White House insists there's been no change in position here. They say while the president believes a public option is the best way to increase choice and competition, it's never been a make or break for signing health care reform legislation. And while that may be true, this more pointed acknowledgement of that position is likely to anger some of the president's more liberal backers.
There will be disappointment among many progressive groups. If they don't get the public option, there'll be a lot of Democratic members of Congress that will be disappointed too.
But Jennifer Palmieri, who worked for the Clinton administration during the failed health care reform efforts of the 1990s, says Democrats can't let the perfect be the enemy of the good.
If that's what it takes to get the most conservative Democrats on board, or if that's what it takes to get Republican senators on board, if that's what it takes to get to 60 votes in the Senate, I think that a majority of people will accept that.
A bipartisan group of senators has been meeting for weeks trying to devise a bill that does not include the public option. It's still unclear whether it will win support when lawmakers return from the August recess. Julie Pace, The Associated Press, The White House.